Hello everyone and welcome to our next in our regular webinar series this evening with the Alphazita team. It's so lovely to have you join us here. My name is Sarah Holland. I'm a member of the Alphazita team and also your host for this evening. And our webinar topic is benefits from fertility acupuncture and learn how it can improve your fertility journey. Now, I'm joined by two members of our Alphazita team this evening, Gordana Petrovic and Dr. Elias Sakos. They have got a lot to share with you in this 40 minutes, but we are also going to allow some time towards the end for questions and answers. So if you have any questions that come up, anything you would like to know more about fertility, acupuncture, your own situation, anything else you'd like to ask both of our speakers this evening, you are very welcome to. We also have a special guest who will be joining us soon, who is one of Gordana's wonderful clients. So it's going to be really interesting to hear her own perspective of acupuncture as well. So you may well have listened to our webinars in previous months. We've been featuring different members of the teams on different topics. So we have the whole archive of them for you to go and have a look at if you wish to once you're registered. So feel free to go look at the website alphazita.com to look at previous webinars. This evening's topic, acupuncture, I know is a really popular one. I know acupuncture is such a popular therapy. It was one of my favourite things that I did for my own fertility when I was trying for my first baby. And I know, I would say it's probably the therapy that most people try. I don't know if you agree with that, Gordana, but it feels to me like it's right. The one that most people on a fertility journey have some, if not quite a lot, as I did,
That's
acupuncture.
Right.
It's very popular because it gets great results. So we're going to hear all about that soon. So I'll hand you over first of all to our two speakers, to Dr. Sakos and to Gordana Petrovic. If we could start with you, Dr. Sakos, if you could give us a brief introduction to yourself and who you are.
Oh, hello. Thank you so much, Sarah Holland. Thank you, Gordana Petrovic, and thank you, Catherine, for joining us today. It's a great honor to be part of this group because I have fulfilled, I think, partly my dream of having a holistic team around me. As a physician of 25 plus years experience, I've always felt that I was not giving enough to my patients by just being technical and medical. And thanks to people like yourself, Sarah Holland, the fertility coach and EFT specialist, thanks to Gordana Petrovic, our acupuncturist, thanks to Claire Spink, who is the fertility massage specialist, and of course Rosie Letts, who is a fertility nutritionist. Now I believe that we can give a rounded approach to our patients and a rounded approach to our couples in the journey of fertility. As a doctor, I now feel that I can rely on wonderful people, very experts in the field, in order to fulfill the dream of motherhood and parenthood, of course. So it's a great honor to be part of this team. Thank you.
Okay, so a little bit about me. I'm Gordana Petrovic, as Sarah Holland, my colleague, mentioned, and I am the acupuncturist for about 10, 12 years experience. And I have always been inclined to help women and couples in their journey through fertility to parenthood. And I find acupuncture to be one of the, as Sarah mentioned, one of the most sought for therapies for improving fertility chances and improving chances of becoming a parent. Acupuncture has been around for many, many years. Over 5,000 years, and today it's becoming increasingly popular, and it's included in many of the IVF units in the UK and abroad, and it's taken also as a separate therapy along the journey of people wanting to conceive, couples wanting to conceive. So the nature of acupuncture as a Chinese medicine model is holistic in itself because it does treat all levels of the patient, all parts of the patient, body, mind, and soul, making an impact on their physical, physiological, psychological, emotional levels, all at different times. To a certain degree. So, you know, it would depend, obviously, how we approach this therapy. Now, these days, I have to say I'm incredibly proud to be member of this team, member of the Embryo Clinic and Alphazita team, complementary medicine gaining its rightful place among the medical practices. It's an amazing privilege to be part of this team and being able to offer an overall fantastic holistic care to our patients and help them along to becoming a parent. So my dream, as yours, Dr. Tsakos, was always to have a rounded approach. Mine from a complementary medicine practitioner point of view, wanting to include what I know and what I think works really well for all our patients within the medical context, because the two work always best together. So that is my experience. So, Dr. Tsakos, what is your experience with acupuncture? I know we've talked about this before many, many times, but I would like to hear, what do you think about acupuncture personally? What is your view, both as a person and as an MD?
Sure. I mean, from my point of view, there's two elements in fertility acupuncture. One is that by having a fertility acupuncturist on the team, it's like having someone else to have a strong contact with the patients. This is another point of contact, because as part of the team, the acupuncturist is aware of the medical problems, of the psychological problems, of the logistical problems, and so forth of the couples. And this is a challenge for all of us to approach and solve. So acupuncture is not just placing the needles. As Gordana Petrovic many times has mentioned, anyone can do that. So it's much more than doing that. The acupuncturist is a specialist, is a fertility practitioner who is also takes a very, very important role in participating in the process of the couple's journey. And this is far beyond just placing the needles and obviously giving the therapeutic effect of acupuncture itself. So this is one element. So the acupuncture the acupuncturist is a member of the team who has the opportunity to explore areas of the couple's physique, characteristics, psychology, function by doing all those exams before they perform the acupuncture, and they can always feed back into the team in a holistic approach as to what may be necessary or what we may be missing out on. So that is one element. And the second element, of course, is the diagnostic and therapeutic element of acupuncture itself. I think there's a lot of research now showing the benefits of acupuncture and fertility, always in the context of a scientific approach. Of course, acupuncture is not going to work if somebody has blocked tubes and they're trying ovulation induction, for example. And that's why it is very important to be part of the team, to be specialized, because acupuncture is like a general medicine, for example. A general physician perhaps is not very familiar with fertility, or a general physician is not very familiar with diabetes unless they're specialized into that. So even within acupuncture itself as a science, and even within acupuncturists themselves as practitioners, it is very important for them to be highly specialized and highly skilled in the fertility approach. So these are the two elements that, in my opinion, make an amazing difference. They make the life of the physician, the life of the doctors and the nurse and the midwives much easier, because the patients are even better trained when they come to see us. They're even better prepared for what they are going to be faced with. Somebody has spent time with them. Time is precious, and this is something we don't always have to give them. So we embrace the acupuncturists as very important people, because they do make our lives easier, and of course they make this amazing contribution into the experience of the couple as well as the success.
Yes, that's right. I mean, that's beautifully put, because it's true. This is where this truly holistic approach comes to life, because it's very important for me as a practitioner, and Catherine will mention later as well, to be able to know what is happening medically, and to have somebody to fall back on and to consult on, and to talk about this, which, this aspect which is not, to me, totally known, and look through the results and look what has been done and what the plans would be. And then obviously from my own side, look into other aspects that you might not be covering. So, for example, very often, working from my experience working in units, both, here in UK and abroad, looking into the stress element within the clinical setting, looking for how to help the patient recover after the egg collection, how to work with them pre and post embryo transfer, not only with the needles, as you say, spending time talking to them about it. So it's all of these things that, I'm incredibly grateful to be part of this team, so that I can always have this integration within my own practice, being able to consult with the medical team, being able to bring in whatever I can from my side, talking and advising on lifestyle, possible lifestyle adjustments, nutritional adjustments, and so on. So much so that you exactly said, it's not just putting the needles in, knowing what to do and understanding each patient for their own unique constitution. Obviously, falling back on my knowledge of the Chinese medicine diagnostics as well. But the added bonus for me as a practitioner to have a team of medical specialists is amazing, and we can then work to provide the best solutions for our patients for many different conditions, as you said, with blocked tubes. And if there is anything that requires proper medical intervention, there is really little I can do, but I can prepare for the procedures psychologically, physiologically, to a certain extent as well. So, and not to mention the stress reduction, that's another one that's been well researched for acupuncture, where acupuncture gives good results. So yes, thank you for that. Really nice. And I know that we do services in Greece of acupuncture at the clinic, and obviously in our retreats. What is your feedback from the patients that you've had about their experience of acupuncture, apart from that they're feeling a sensation which is not always very pleasant?
Well, our experience is very clear, and we're actually auditing the results.
Amazing.
Interestingly, the vast majority of patients, they have tried it before.
Yes.
And of those who've tried, and when I say vast majority, I would say possibly 60 to 70% they have tried acupuncture before. In a not so organized manner. So they have been to the acupuncturist like once or twice in an attempt to reduce stress or improve the function of their bowel, or even to improve ovulation. Also, it's very interesting that a lot of those couples have read about acupuncture. They have been pleasantly surprised to find that there is evidence behind improving ovulation through many mechanisms and improving overall fertility outcomes, whether it's natural fertility or assisted fertility.
Yeah.
So our patients seem to be very well informed. So the majority of them, they find it very welcoming. And we tend, of course, to always provide them with a complimentary session just to make sure that they familiarize themselves with the therapist.
Sure.
And of course with the treatment itself. Now, the minority of patients who haven't had it before, and that's possibly about 1/3 of our patients, they're initially apprehensive, but when they are explained by the physician, and I have to stress here that in Greece, the acupuncturists have to be medically qualified. They have to be doctors, and also they have to be specialized in acupuncture. And of course, we're fortunate enough to have them subspecialized by Gordana Petrovic in fertility acupuncture. So they're truly highly specialized in providing that service. So they find themselves less stressed after they've spoken to their doctor, to the therapist. And of course, it helps them quite a lot to have this complimentary session, to the extent that, again, more than half of them, they seek to have some sort of packages in order to boost their fertility. So it is part of the And it is part of the care that we suggest to have when they get home, provided that they know what they're doing, who is doing it, and what are they aiming to succeed. So it is part of the service. It is part of the follow-up. It is part of the luteal support coming up to the pregnancy test. And as I'm aware, many of them, they just carry on having that throughout the pregnancy as well, for all those benefits that are associated with a less complicated pregnancy. So I think acupuncture has won the contest of becoming really an integrated, important part of the fertility journey.
Yeah, amazing. It's so good to hear, especially good to hear from a doctor, because it's not been the case for many years, and it's now becoming part of a mainstream medicine, so to speak. Small part, but it's still a part, and I think it's growing. So that's amazing to hear, and I'm personally very, very pleased to hear, because I always hear the feedbacks from my patients, from me and an occasional great doctor such as yourself. But it's really good to hear, and it's good to for our viewers to hear it as well. And I think that at this point, when we're talking about acupuncture and talking about our experiences, I'd like to bring in Catherine. Catherine,
hi.
A patient of mine for many, many years, and now a friend as well, and has had numerous sessions of acupuncture over the years, related to not only fertility and not only towards her pregnancy. She now does have a little one who is 2 in May. And so I was just wondering, what can you tell us about your experience of acupuncture, and how was it for you? I know we've discussed it so many times, but it'll be nice for the viewers as well to have an insight. How was it for you as a real person on the other end of the needle sharpness?
So as you said, we've known each other for a few years now, and I think for me, when I decided to start acupuncture, it was something really proactive and positive that I could do myself that would help improve my fertility and help towards that kind of the baby journey. And it was at a time when I felt so frustrated because we just weren't getting pregnant, and there wasn't anything more I could be doing. So I thought I need to kind of, I need to start looking at other avenues, and that's where we met. And I looked for fertility acupuncturists, and lots of people said to me, "Have you tried acupuncture?" So I started, and I found it immediately beneficial I felt a lot calmer when I was having regular treatments. I noticed that my cycles were really regular. I noticed the quality of my cycles were much improved, and my ovulation became obvious and regular each month, and I just felt generally more in tune and in balance with myself. My acupuncture sessions with you, Gordana, they were like counselling for me, because I saw you so much, and you were such a part of the, at times, awful journey that we were on to have a baby that just wasn't happening. And we did end up having IVF, and I think by the time we got to IVF, I'd had a lot of acupuncture. My head was in a much better place. My body was in a much better place. My cycles were really regular. I had great, lining thickness. I went in for my fresh cycle. You gave me treatment throughout my fresh cycle. I think it's a couple of years ago now, but I think it was something like I had 20 follicles, 15 eggs, 10 fertilized. And then I ended up with having 1 transferred, a 5-day transfer, which turned into my son, who's 2 in May. And then I had 3 more frozen from that round, of which I've just had another frozen one transferred again, and I'm now pregnant again with baby number 2, which is amazing.
Truly.
It's just, I really feel that had I not had the acupuncture, had not had that kind of space and that time with you to really kind of sort my body into like most tip-top, regulated, boosted position it could be in, sort my mind out so that I was in the best place possible, I don't think it would have gone as smoothly. And I feel it really supported me throughout that. And then I saw you throughout my entire pregnancy with my son, right up until the very, very end, when I waddle into your house and precariously climb the couch. But it was just, you helped me with all my symptoms, all my aches and pains, all my morning sickness, all my headaches. I had awful headaches throughout pregnancy, but you really helped me with them. And most of all, you were my one constant throughout my fertility journey, where you just knew everything that had gone on. I'd arrived with my latest blood test results, and this doctor said this, and this person said this, and all the rest of it. So it was just, like Dr. Sacco said, it's someone else who can give you the time, who has the experience and the knowledge to share with you, and can really support you on that journey, mentally, emotionally, and physically. And I recommend it to everyone. I think it's brilliant.
Oh, well, I couldn't have asked for a better testimonial. All linking to, I mean, yeah. it's just, first of all, obviously it's genuine and it's true, yeah. And it just brings in exactly what Dr. Tsakos was saying, and fits into what I'm saying, and to the letter, because this is what this is all about. We can look. I mean, I sometimes have clients coming from colleagues who have addressed single issues, separate issues, but were not specialized in fertility, and it all worked very well. But people do want an added a service, so to speak, of talking, of advising, of possibly cross-referring. And this is how Alphazita came about, because we are a team that cross-refers in between our patients, is obviously with the agreement of the patient, but how we treat them all from our respective sides. It's very important to have an overall, as you are saying, we can address the pains and the aches and regulate the cycle, but then there are some issues, like in yours and many other cases, where IVF works the best. And when this can all be brought together, whatever we are all doing from our own respective fields, this is what happens. And as far as acupuncture is concerned, it really is not just needles in. You need to talk. You need to be able to provide the advice. And if you don't know what is happening, to be honest enough to say, okay, well, this is it, not so sure. And I have said that before. I'm sure that there was something I was not sure about, and I will consult the medical doctor. I will ask more. I will look into more. So it's really not just about the acupuncture, putting the needles in. Certainly, I just have to stress at this point as well that it's got to be an authentic Chinese medicine, traditional Chinese medicine acupuncture. So not just a localized treatment into your lower abdomen if you need a boosting of the follicle production, or if you want to regulate the cycle, so you put it in the actual area. It's got to be based on the principles of the Chinese medicine, and that's why it does work so well. Thank you so much. That's such a lovely testimonial from you, Catherine, and I'm so pleased with little one and another one just en route.
Thank you very much.
So good to hear, Catherine.
Very good to hear from you.
While you're still with us, Catherine, we've had a question come in, which I'd actually love.
Oh, yes.
I'd love you to answer rather than Gordana, because I would like a true answer from
no, it doesn't. So it doesn't hurt, but it does feel weird. So the needle going into your skin itself doesn't hurt. It kind of, it really doesn't. It's just as if you just tapped the end of a drawing pin, it's that sort of pain for a second. The dirty is what the kind of the weird, funny feeling is. That's almost like when you bang your elbow and you catch your funny bone. It gets that kind of funny, weird vibration feeling. You just think, oh, and then it goes. And that's kind of when you know it's working. And when Gordana kind of gets all excited that she's hit the right bit, so she starts twiddling needles and stuff. So yeah, it doesn't hurt, but it's a very unusual sensation, which you won't have necessarily felt before. It's a very, I only felt it from acupuncture. It lasts less than a second, and then the benefits just outweigh anything more. The benefits are huge. So for me, there's no downside. And also, just to add for anyone who is watching, who is thinking about having IVF, and perhaps age is in their mind as well. I was 37 when I had my son. I'm now 39 and will be 40 when all things going well this pregnancy when I have this pregnancy. So, you know, kind of from an age point of view, Gordana really helped me as well, kind of get my head around that and also boost all my kind of my cycles, etc. So just thought I'd mention that in case anyone was thinking about an age thing. So, yeah.
Thank you for that.
Thank you,
thank you so much. I mean, just to add to what you said, Catherine, about the chi, it's so terribly experienced, unbelievable. You're such an advocate, because the chi is a sensation that Catherine was explaining as feeling of heaviness and achiness, which is momentary, and it probably lasts for a few seconds. It is indeed a indication that we are in the right spot. So we are activating the right point on the right channel that we really wanted to address. And it doesn't, the hurt is exactly, as you say, second it goes in, or even not that, depending on which place it is inserted. But yes, this is a strange feeling. I would explain that as well, as you hit your funny bone. Yeah, that's what it is. But afterwards, you just know that this is what's happening. And another sensation is gurgling in your stomach. So wherever we put the needle, if there is gurgling in your stomach, it is a sure sign that the chi, the energy, is where it should be. So that's our little sign. So for the person who was asking the question. So yeah, that's very nice of you. Thank you.
Really
Thank you so much. Really good to hear. And I hope you stay with us for the rest of the
webinar.
But if you need to look after your precious little one, then we can say thank you. We need to say thank you. Thank you so much for your input. Thank you very much for that, and I'll speak to you soon. All the best.
Speak to you soon. Good
Love
luck,
to the family. Bye-bye.
Thanks. Take care.
Bye.
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 Thank you. If I can make a very quick comment here, we should not forget our men.
That's right.
Patients. Male patients, and acupuncture, in my experience, works fantastically with men, because although we do love women, and women are doing most of the hard work, sometimes men are also in need of some attention and some counseling and some acupuncture. So in our experience over the last few years, we found that our male patients, they find it quite relieving when somebody takes an interest in them. An acupuncturist talks to them a little bit more than the physicians do, or the scientists in the lab do. Usually men are neglected, unfortunately.
Yes.
They either have a normal sperm count or they don't. And in either case, it's usually a very short time we spend with them. So by providing acupuncture in the holistic way, by talking to them, counseling them, we find that men's stress levels go down. We find that they improve their experience, which means that they can support their spouse even better. And of course, in some elements, acupuncture may help reducing the stress, so that they produce the sperm at the right time, in a more appropriate way. And of course, they feel much more involved in the whole process when somebody really takes an interest in them. So I would highly recommend that we should not forget our male patients, whether they do have a male problem or whether they're just escorting and they're being supportive to their spouses and partners. And by offering acupuncture and acupuncture counseling to them, we can have really good results and very grateful and good experienced patients.
It's a great point, Dr. Tsakos, because I do work with couples more and more so, precisely for the reason that you said. I sometimes just feel taken out. The whole, highlight is on the woman, which sometimes can even feel as a pressure on a woman. And then when there is this shared experience of having the treatment distributed to both of them, that goes away. And lately, I've had about 5 or 6 couples requesting to be treated as couples, which is interesting. So people are coming together to the understanding that this is important, and there are certainly many ways we can improve the men's lives, so to speak, quality of lives and quality of their sperm production and other functions during the process. So I think it's a very valid and very important point. that you brought in, because it's just recently that I've had a huge increase in couples coming in wanting to actually have treatment together. Even when you said even if the sperm production is very good for reduction of the stress, for better understanding what a woman is going through, and so on, and also sharing the experience. So yeah, absolutely very important. And I'd say another important thing from an acupuncturist point of view, which is really, really important, is how you choose your acupuncturist. So it's the same way when you're looking to find a doctor to look after you, a gynecologist, or a clinic if you're undergoing IVF. It's very important to look for your acupuncturist in the right way. They have to be qualified, experienced, registered, and so forth, but primarily somebody who really knows what they're doing. They have to be versed in both elements of conventional medicine, especially elements of conventional medicine related to the IVF, if this is the route, so that they are able to recognize what's going on and then gear your treatment cycles according to what is actually happening in the IVF clinic or on the IVF journey. So I can't stress that enough. You really need a person who knows what they're doing. And I always say, do ask. Do not hesitate to ask for the qualifications, for the postgraduate training, for references if needs be. Do not hesitate and just take the word for it. It's very important to get a person who knows what they're doing in their respective field. And also, if you're going through the IVF or planning IVF, somebody who does have experience working with patients on that route as well. So that would be my strongly suggested suggestion, a strong suggestion for you to consider when you're deciding who you are going to have, just in exactly the same way as you're deciding who's your doctor, who's looking after you, and which clinic are you going to. So do you agree, Dr. Tsakos?
Absolutely, but I'm getting a bit stressed now as we're having
get some
acupuncture
to answer. Okay.
There's always so much to say.
Would you mind? Yeah.
We
Sarah,
have
would you mind organizing those questions, please?
Absolutely. Yeah, we have around 8 minutes to go through some questions. So this is going to be a little bit of a quick fire round, but I'm sure that your answers to these are going to expand on what a lot of our viewers want to hear as well. So this is going to be interesting to hear.
Okay, let's hear it.
One question here is quite specific, and I must admit this is a condition I haven't heard of myself, so I hope I pronounce it correctly. This is from Olga. She says, I've had 10 regular acupuncture fertility treatments together with my husband, as you were saying there, the couple going together, from my Chinese doctor. At the point, he asked us to have a torch test giving a positive on cytomegalovirus. Mm-hmm. Are we familiar with that? I'm sure you two, much more medical people than me, have heard of that. Good. Mm-hmm. He said it is the reason for my recurrent miscarriages. Can acupuncture help with the treatment of this? I
personally didn't have experience with that because, sorry, Dr. Tsakos, it was, can acupuncture help with it? In terms of this particular virus, I have not had experience in treating this personally. And I wouldn't be able to say whether that would be the reason for the miscarriage. What I would do, I would probably refer to an MD for that confirmation, because as an acupuncturist, and I am an acupuncturist, I'm not a herbalist as well. So just to specify, because very often Chinese, if this was a Chinese doctor, Chinese person as well, they're qualified both in herbology, so pharmacology, and acupuncture. So he might have known more about that, but I would be always inclined to send for further testing and refer to an MD, to a qualified medical doctor for this diagnosis. Personally, this is what I would do. Dr. Tsakos,
sure. If I can answer that, I don't think there's any evidence that acupuncture can treat viral infections, and I think we have to be clear about this. Acupuncture, as we all know, may treat and manage and modify functional disorders, but an infection cannot be treated with acupuncture. So we have to be very strict about that. On the other hand, there's no clear evidence, dear Olga, whether CMV positivity is actually associated in a causative manner with miscarriages. So very well done to your Chinese doctor who suggested the torch. And may I encourage all of you to have those standard investigations anyway, including the viral screen, the torch screen, the hepatitis, HIV, and so forth in the journey to parenthood. But I don't think there's clear association with either the benefits of acupuncture or with miscarriages themselves. So
possibly why I've never had anyone. I never had anyone coming with that, and I wouldn't be, as I said, I wouldn't be confident of doing treatment for this particular reason. That's why I said I would refer to an MD, because this is this particular situation where we have to be clear of the scope of acupuncture and the scope of conventional medicine.
Thank you. Thank you both.
Thank you for your question, Olga. All the best.
We've had 2 questions come in that I think probably can be answered together about the kind of logistics and how acupuncture works. So Alana asked, how often would you recommend having acupuncture, weekly, fortnightly, or monthly? And Liz asked, how long does an acupuncture session last, or is it dependent on the individual? So what does it look like then to have some treatments?
So for Alana and for Liz, answering together is pushed for time, but it links very nicely together. And it's actually something I was going to mention, so it's a good cue. Thank you. It is best to have, if you're planning a natural conception, it's 2 to 3 months, so we can follow the cycles and regulate whatever we can within these few months. Weekly treatments or every 2 weeks. It would depend on the person. On a first appointment, which is, Liz, I think you've asked, is about a booking appointment is between 60 and 75 minutes usually. So we allow about that time where we would assess what is going on, look into your constitution, look into your signs and symptoms, medical history, any medication that you are taking, any previous medical conditions, and so on, lifestyle, diet. Look into your tongue, feel your pulse, and then we would have some idea where we are, and then also we will tailor make that according to your needs. So in a way, 60-75 minutes, yes, most likely for the first one, 45 minutes for the follow-ups in most cases. But it always has to be tailor-made to a person. Sometimes the consultation with some of the patients takes 5 minutes. Sometimes the follow-up, sometimes it takes 15 to 20 minutes. So we have to be aware where, how we want to do that according to your needs. The most important person in the room is you. It's not what I want to do and what I have to say. It's about you. What do you want? What do you feel? And personally, this is how I work. No matter, where, if you need to extend, we extend, or shorten, or whatever, that's relevant. The most important thing is what you really need as a patient, and how I can be of service for your needs towards the best results for you. So that's it. If you are just coming for an IVF, Alana, during the IVF cycle, for example, then we tailor make around the treatments that are most of the time around egg collection, then embryo transfer, and during the dreaded 2-week wait. Again, you can't overdose on acupuncture. You can have it every other day. It's not always feasible, not possible, but there are no contraindications of having it every other day. Once a month is probably too little if there are any chronic issues to be solved. So I'd say weekly or once every 2 weeks. For obviously the period of time that we need to assess on the first booking appointment. Hope that answers that for you, Alana and Liz.
Thank you. Thank you, Galdana.
We have certain. I know we have only a few more minutes left.
We do.
There's
We have
a very nice question from Lena. What if I try acupuncture for another way to support fertility, like smoking cessation or weight control? I think this is a very good point, Lena. Thank you for the question. Indeed, acupuncture may be very helpful in the context of smoking cessation and weight control. And this could also be addressed with the acupuncturist and also with the fertility team, because that could be an added benefit of acupuncture itself. So by all means, do not hesitate to discuss smoking and weight control with the acupuncturist, and I'm sure that you will find a way to work around it in a holistic way and in a synergistic way towards the fertility overall outcome.
Yes, absolutely. That's a very valid point, because both smoking and excess weight are contributing to a slight difficulty in conceiving. So it would be beneficial to look into these options as well. And yes, acupuncture, especially for smoking cessation, is quite well documented that it works. There is a protocol even for it. So yes, there's a lot that can be done, of course, which is not directly fertility related, but indirectly. Yeah.
I think we're just coming up to time, but that to me is a perfect kind of summing up of us as a team, the holistic way that we don't just look at fertility, we're looking at the woman, the couple as a whole, and the whole picture of health, their mind, their body, their spirit. So yeah, they may come for fertility acupuncture to improve their ovulation or prepare for IVF, but there's always going to be other strands to be looked at as well, aren't there? Which is the benefit of a holistic approach.
That's right.
To healthcare in general. So thank you very much, both of you, for sharing so much in the time that we had available. I hope that you found that interesting, everyone who's been listening in. As you know, these are regular webinar series that we're running around once a month. We come together as a team and we're featuring different members of the team each time on different topics. We still have lots to share with you. You'll be hearing about our next webinar very soon, so do look out for the emails, and we have lots of other support coming as well, lots of ways that you'll be able to connect with us as a team and be supported on your fertility journey. So thank you very much. Any last words from either of you as well?
Yeah, so I would love to answer to Elizabeth, who just put in a question as to whether it's possible for someone to get pregnant with low sperm count, Elizabeth. And the answer is absolutely yes. Today, I delivered someone who's had IVF for low sperm count for the first baby, and then they conceived spontaneously. And the baby was born today, actually. So indeed, low sperm count doesn't mean sterility. It may mean infertility, and infertility has different degrees. So please, Elizabeth, you just squeezed in this question in the last minute. So please don't hesitate to contact me personally, and I should be able to explore complementary any possibilities of you exploring either natural or assisted fertility. So the bottom answer is that definitely yes. Even with low sperm count, pregnancy could be achieved either naturally or with a little bit of help.
Amazing.
Great. Thank you very much. Thank you to everyone who's taken part, our listeners, and to Catherine as well, who's no longer with us at the moment, and to our wonderful speakers this evening.
Thank you, Sarah.
And
thank you, Dr. Sack. Thank you.
Thank you.
Thank you both, Gordana and Sarah. Thank you very much.
Thank you. Good evening, everybody.
Bye-bye.
Thank you. Bye.
Bye.
Bye-bye.
Bye-bye.
Bye. Good night.